So Psittacosis या parrot fever, it is also known as ornithosis. It is also known as ornithosis, and it is caused by the bacteria Chlamydophila psittaci. Chlamydophila psittaci, it is a pathogen of parrot and other psittacean birds. Psittacean birds means other birds of the parrot family like parakeets, macaws, cock- cockatiels, and it causes psittacosis or parrot fever or ornithosis. What are the reservoir of these diseases? It could be pet birds like parrots, parakeets, macaws, and cockatiels, or could be poultry like turkeys and ducks. They act as natural reservoir of infection and are involved in the transmission to humans. So psittacosis, it is a zoonotic disease. It primarily infects the bird, but it can also be transmitted to humans. And what are the reservoir? Pet birds like parrots, parakeets, macaws, and cockatiels, and poultry birds like turkeys and ducks. What is the mode of transmission of Chlamydophila psittaci? तो बर्ड्स के नेसल डिस्चार्ज से जो एरोसोल्स जनरेट होते हैं उनके इन्हलेशन के कारण ह्यूमन्स इन्फेक्टेड हो सकते हैं. सो humans can be infected by inhalation of the aerosols from avian nasal discharge. Avian means birds. और from infectious avian fecal या feather dust. ठीक है, तो जो भी fecal या feather dust में Chlamydophila psittaci हो गए उनके कारण ये humans में ट्रांसमिट हो सकते हैं. So it can be transmitted by inhalation of aerosols from avian nasal discharge and from infectious fecal and feather discharge. Incubation period is 5 to 19 days. The range of incubation period is 5 to 19 days, and it can present as respiratory manifestation, which is the most common manifestation. It varies from mild influenza like syndrome to interstitial pneumonia, and very rarely it can even cause septicemia and typhoid like syndrome. ठीक है, तो शिटाकोसिस या ऑर्निथोसिस का क्लिनिकल मैनिफेस्टेशन क्या है? मोस्ट कॉमन मैनिफेस्टेशन है रेस्पिरेटरी मैनिफेस्टेशन. ठीक है, माइल्ड इन्फ्लुएंजा लाइक सिंड्रोम से इंटरस्टिशियल निमोनिया हो सकता है. ठीक है, और कुछ केसेस में बहुत रेयरली सेप्टिसीमिया या टाइफॉइड लाइक सिंड्रोम होता है. टेट्रासाइक्लिन इज़ द ड्रग ऑफ चॉइस. It is given 250 milligram 4 times a day for at least 3 weeks to avoid relapse. Tetracycline is the drug of choice and it is given 250 milligram 4 times a day. Okay. And it is given for at least 3 weeks ताकि relapse ना हो. और alternative क्या है tetracycline का? Erythromycin. If erythromycin is given, then it is given 500 milligram 4 times a day per oral. ठीक है, तो शिटाकोसिस या ornithosis, it is a zoonotic disease. Reservoir is pet birds like parrot, parakeets, macaws, cockatiels या poultry like turkeys and ducks. Mode of transmission: inhalation of aerosols from bird nasal discharge and from infectious avian fecal and feather dust. Clinical manifestation: respiratory manifestation, most common from mild influenza like syndrome to interstitial pneumonia, and rarely it can cause septicemia and typhoid like syndrome. Treatment: tetracycline is the drug of choice. Erythromycin can be the alternative.